When I was doing one of my clinical rotations to finish off physical therapy school, I had a patient who was new to the clinic that I was interning at and brand new to physical therapy itself. And so they were coming in after recently having had their shoulder replaced following a traumatic fall that broke the very upper part of their arm bone. Now, this patient was super lovely, and as I began to go through the subjective evaluation, which is the beginning part of the session where I learn about what happened and ask some questions about how they've been feeling since the accident and the subsequent surgery, it was quite apparent that the patient was nervous for a variety of reasons. Now, there were a lot of emotions that they were experiencing, most of which centered around not fully understanding what had taken place with the surgery, if they would ever be able to use that arm the same way before the injury, or if the required physical therapy was going to be painful and how long they would need to attend therapy for. And so they had a lot of questions that hadn't been answered by anyone else, and as a result, going to physical therapy was a process that brought along a lot of unsettling emotions. And uncertainty can be an incredibly uncomfortable feeling, and it can make us feel anxious or nervous in all sorts of ways. And this is an absolutely valid feeling to experience. And to this day, I've never forgotten those sessions as they helped me to understand the power of educating nervous patients to create an effective therapeutic alliance. Now, physical therapy is an incredibly diverse profession, and it can evoke different thoughts and emotions to each individual based on what they've heard about physical therapy, what they've read about physical therapy, or even what they imagine it to be. And since people go to physical therapy for a near infinite number of injuries, conditions, or other reasons, the type of treatment each individual receives, how that treatment feels, and what their overall experiences are like can vary greatly. Some people have good experiences while others have negative experiences for whatever reasons those may be. And as a result, it can be difficult to know what to expect or what your physical therapy experience may be like. So if you find yourself nervous about the thought of going to physical therapy for whatever the reason or reasons may be, I'd like to let you know that it's valid and that a good physical therapist will acknowledge this while helping to put you and those anxieties at ease. In the meantime, I'd like to offer some insight around the topic of being nervous in attempts to maybe help to ease some of those nerves or apprehensions that you may have. So if you're heading into physical therapy for some aspect of rehabilitation after an injury or a particular condition that you may have, you may find that you have a lot of questions. Now, whether it's questions about what has happened since your injury or condition took place, what the recovery process looks like, why you're experiencing pain or discomfort, or anything else, your physical therapist knows that these are common questions that patients have. Now, arguably, our most important job as physical therapists is to educate our patients. Now, education is absolutely everything when it comes to injury recovery and improvement of your condition. And it's been shown within the scientific literature to improve patient outcomes in multiple ways. Even just having an understanding of your underlying injury or condition can help reduce feelings of perceived helplessness, prevent catastrophization of your thoughts, and even help decrease pain. So a great place to start with helping you feel more comfortable with getting ready for physical therapy is to write down any and all questions that you may have, especially the ones that you believe are making you feel most apprehensive. Now, whatever the question is, I'd encourage you to write it down. Whether it's for questions pertaining to you specifically, the process of therapy, or anything else, getting your questions answered can help put you more at ease and initiate the therapeutic process. So starting your recovery by getting your questions answered can be an amazing feeling, and I'm sure that many of my patients would attest to this as I see it constantly with those whom I treat. So don't think it weird or silly to write down a list of questions and then ask them to your therapist one by one. Lots of patients do this, and I often find that I can tell that they're feeling more at ease after asking those questions and getting a better understanding towards the overall process of recovery. Now, I can't tell you what physical therapy will be like for you, as so much of the treatment and recovery process depends on your injury or condition, and then your infinite number of other factors that are unique to you and your situation. But I would encourage you to acknowledge how you're feeling and thereafter give yourself permission to be brave. Now, the road to recovery is not always easy, but if you're willing to remind yourself that there is something to be gained from the process, be it physical healing, mental strengthening, knowledge acquisition, or any other positive aspect, then you'll walk away uniquely qualified to help others in the same circumstance down the road. So keep that in mind. And I would gently remind you that if you're going to go through the process of recovery, you might as well get something out of it so that you can not only benefit from it yourself, but so that you can also share it with the world as a result. It's entirely possible that later on in life you will come across someone going through the same injury or similar circumstance that you did, at which point you can speak life into them through the unique qualification that you have after having gone through it yourself. And I'd also like to encourage you not to put pressure on yourself when it comes to worrying that your physical therapist might see you in an emotional state. Now, pain and physical disability or dealing with a challenging condition can be incredibly disheartening. And as a physical therapist, I'm very aware that I might not be seeing you at your best, and that's just fine. Any good physical therapist will be aware of this and won't pass judgment on you when it comes to you having a rough day, be it physically or emotionally. So just breathe and know that we see these things all the time, and trust me, we as therapists too, we're human, and so we get it. Now, when it comes to the actual physical therapist who will be treating you and guiding you along your road to recovery, I'm certainly hoping that you'll feel that they are the perfect fit for you. The right physical therapist makes all the difference when it comes not only to feeling at ease during your session, but also feeling confident in the overall rehabilitative process. And so if you can feel or develop a sense of trust with your therapist, your outcomes are likely going to be a lot better, and your treatment sessions will be much more enjoyable. And this therapeutic alliance, as we call it, can not only make the overall process a much more positive experience, but also one that is much more meaningful, which will also help you achieve healing that is quicker and more complete. But if you don't feel like your physical therapist is a good fit for you, or that they might not have your best interests, it's okay to seek another therapist if that's an option for you. Yes, doing this can be a bit more time and energy consuming, which makes it a bit frustrating, but if you truly don't feel that your therapist is a great fit for whatever reason, then don't be afraid to seek out another one. And this happens even with me in the clinic, where I feel that the patient I'm treating might experience better results or outcomes with another therapist in our clinic, or they might enjoy their treatment styles more, or they might even just be more comfortable with them. Now, no one therapist is right for every single patient who walks through the doors, and I'm certainly no exception to this. And as a result, if I feel that a patient would like to be treated by another therapist, or that they request trying treatment with another therapist, I'm more than happy to set them up with another one, because it's not about me, it's about you, the patient. Now, if you're worried about experiencing pain during treatment, ask your therapist what the overall recovery process will look like and what type of treatment might be involved. And the good news here is that not all injury recovery treatments are painful. And while pain or discomfort is sometimes experienced, it may help you to know that the most painful or physically uncomfortable treatment sessions tend to be at the start of your recovery. And as you physically heal and regain your functional abilities, the tissues and structures within your body become healthier and become less painful during treatments and exercises. So it might just be that the most uncomfortable part of therapy will be at the very beginning. Another helpful tip I'd like to suggest is to bring a loved one or a friend if you feel that it'll help to put you at ease. As long as we have your consent to perform the treatment session with them being present, we're more than happy to do so. And whether it's your partner, a family member, or anyone else whom you confide in, this can be a great move to make, as it's one that plenty of patients opt for, be it due to nerves or for other reasons. And what's great about this is that they can not only ask questions on your behalf, but they can also act as an extra set of ears to help you remember any specific insight or information that is discussed during the treatment session, which can help you to get more out of each session. And this was something that my patient who had their shoulder replacement did. Her husband would attend the therapy sessions, and helping to answer his questions not only enlightened him, but also helped to put him at ease as well. And so if it helps to put you at ease to bring a companion along to your therapy, as physical therapists, we're all for it. And above all else, know that you are absolutely worth it. And I wish I could instantly snap my fingers and just make you better so that you didn't even have to think about therapy. But since I can't do that, perhaps the next best thing I can do is to let you know that if you can dig deep and give this physical therapy thing a shot, you'll walk away uniquely qualified to speak life into others who will one day be in the very same or very similar circumstances that you're currently in. So breathe deep and know that good things happen when you give yourself permission to be brave. And keep in mind that going to physical therapy will help not only yourself, but those you meet in the future whom you'll be able to speak life into for their own situation. And if they're nervous, you'll be able to bring them comfort through your own story. And when it comes to healing, there's power in a good story. So keep looking after yourself, keep looking after others, keep making great things happen, and I'll see you in the next video.